I got to see a brain on the first day being there after never working in a hospital before.
Because I wanted to expand my horizons culturally since I'd never been outside the US before.
I wanted some real in-person hospital experience.
I wanted to see a global perspective of healthcare.
I get to work around 7:30 a.m. or even earlier. I'll go to, first off, the meeting with the department where we'll discuss what is happening throughout the day. And then we'll do walk-arounds where we'll see patients in the ward and we'll go and look at them, and occasionally the doctors will come up to us and explain in English about what has happened to this patient and what their treatment might be and things like that.
In the neurosurgical unit, I was mostly observing almost every single day. I was in the OR observing different types of brain surgeries. Whereas where I got to oncology, I was doing a little bit more shadowing in the nursing department, a lot of post-op with wound cleaning and patient cleaning, along with like colostomy bag changing.
The thing that surprised me most about healthcare in Vietnam was the sense of community that's built into the healthcare system here. People are very hospitable and want to look out for each other, and it's almost second nature. Even when you're in like a patient room, there will be like 8+ people just in one room. And in the United States, it's shocking when you even see more than 2 people in a room.
There is a lot larger flow of patients through the hospital than compared to the US. I believe they said they only have 7 doctors in the clinic each day and 300 or more patients each day. This is for spinal specifically, as well as 30 to 40 operations going on every single day.
In America, we have a thing called HIPAA, which is mostly privacy. But when I first came here, I immediately saw patients in the hallways and doctors or nurses talking about all their ailments out in the open, free to everyone to hear, which is kind of shocking.
So something I found super interesting was how quickly that they worked. When I was working in neurosurgery, I found out that most surgeons were doing about 5 or 6 surgeries a day.
Also, how resourceful they are, because there are many instruments that are very expensive. Vietnamese hospitals can use cheaper materials to make the same exact thing, and I think that has also impressed me a lot.
We had an extremely rare case of like cancer. It was a 12-kilogram liposarcoma tumor, and my supervisor gave me the amazing opportunity to scrub in and hold it.
I came in just at the right time during a surgery where they were taking out a particularly difficult spinal tumor, like right next to the brainstem. And just seeing the look of relief and like celebration on everybody's faces once they got it out was really inspiring.
So my supervisor is one of the only surgeons that could do ear reconstruction surgery in one surgery. Usually they do it in 5, but she could do it in 1. And not only is she the only one, there's 2 of them actually. They both told me was that in the whole world, there's only like around 300. So Viet Duc has 2 out of the 300 surgeons that could do an ear reconstruction surgery in 1 surgery.
And I got to see a brain on the first day being there after never working in a hospital before.
The meeting with Dr. Hui from Pink Lotus was very inspirational. He was a doctor, but he switched out of it because he had more enjoyment in another field that actually he enjoyed instead of just doing something to check it off. And I feel like that's what I should be doing. I should really just enjoy my passion and do what I really want to do, and that's how I'll fulfill my life, not money.
One thing that challenged me the most in this internship was definitely the language barrier. I did end up taking Vietnamese classes with your broader program, and they helped a lot because I was able to communicate basic things with my colleagues, and that helped, yes.
Before I came here, one of my options was cardiothoracic surgery and plastic surgery. I watched both of those. I was in both of those departments, but I fell more in love with the plastic surgery. I haven't watched the plastic surgery in America, but over here I have, and it was amazing. I fell in love with like the reconstruction, how they made people look more normal.
I think I have a real appreciation for the real devotion and teamwork and compassion it takes to be a doctor here and to spend every day helping others and sometimes neglecting your own needs to do so.
Since I am a first-gen student, like college student, first-gen medical student in my family, going in here, I thought going on the medical path, I thought there would be one rigid path that you have to take, but I realized that are like multiple paths that you can take, and I shouldn't put myself in one rigid mold.
It's not really gonna happen again, so make sure to make the best out of it.
You really want to be able to take in as much information as possible and talk to your surgeons and the nursing staff as much as you can.
This is something where like you're ultimately doing this for yourself and your own career. So it's like what you put into it really is what you get out of it. Just take advantage of what you can and like see the good in everything.
Do not be a stranger. Go out and talk to somebody. This country is actually like really welcoming. You can just talk to anybody. Even they, like honestly, they don't know what I'm saying sometimes, but like they're so like welcoming and everything. It's so nice. Your experience would be so much better and open up a whole lot more opportunities if you go out and put yourself out there.